One of the things that we wanted to do was interview our board members, and I'm sitting here today with Patrick Welch, one of our board members we pulled on because of his experience in certain areas, and he'll let you know what those are. But from my perspective, Patrick is a combat disabled veteran who has had quite a range of experience working with veterans and veterans groups. And that's one of the reasons we wanted him on the IDIC board, is because of that exposure and that experience with those types of things. So I'll let Patrick start and kind of give a sense of how you became involved with trauma area and the veterans groups and all of that.
All right, just for the record, I am not a clinician. My education is in the business standpoint, and my doctorate is in international business. I come at this from a perspective as one who has incurred multiple incidents of trauma and found that part of my healing process was to be involved in helping others that had experienced the same things. My first exposure to a PTSD event was in 1962, before anybody knew what PTSD was, when I was scuba diving with my father and we had an accident and my father drowned when I was 15 years old. Unbeknownst to me, that's an issue that I had suffered some trauma from, and in those days, nobody really knew anything about that type of work. It was always, well, suck it up and move forward. And as a 15-year-old kid, I had lost my father and my best friend and was pretty well left alone by everybody. 6 months later, I lost 3 of my grandparents and an aunt all in 1 month. 2 of them dropped dead right in my arms. So there was 5 issues of PTSD within 7 months. Then I went to Vietnam, and in Vietnam saw people being killed, saw people being maimed, held my best friend in my arms as he took his last breath from a mortar round that he took, a chest wound. So that was more experience in PTSD. When I came home from Vietnam, I had built a shell around myself, because in later years a psychologist had identified to me that I developed what he called the smoking gun theory, in that anybody I let get close to me always seemed to die, and therefore I always kind of kept my distance from people, not wanting to develop any close relationships. Then, for 12 years, my counselor was Dr. Johnny Walker Black, who every night for 12 years told me I was just fine, and it was the rest of the world that was all screwed up. And then after I resolved my drinking problem, I got pretty much back together with my life. And it took me 40 years to initially step forward and say, I have PTSD and I need some help. And then finally got into VA healthcare, experienced work with clinical psychologists, with psychiatrists, was moving toward good recovery, getting things straightened out. And then the last and most painful trauma experience hit me when we lost one of our 7-year-old daughter. And that just threw me back into a tailspin for about 5 years, where I went into a deep depression with suicidal thoughts. I was back in Vietnam. I was losing everybody that I cared about, and again was able to find some help through veterans groups. I got reacquainted with them. And since then, that happened in 1989, and ever since have been heavily engaged in working with veterans with PTSD, with traumatic brain injury, and also working with their families who are incurring secondary PTSD.
No, that's very helpful, and actually you've answered some of the questions I was going to ask you. In terms of the Trauma Institute and the trauma-informed care part of that, how do you see the trauma-informed piece fitting with what you've done or intend to do with veterans?
Well, I think it's a little more concentrated in the areas of working with people. I think from a standpoint of the PTSD treatments that I've been through, a lot of it was kind of superficial, and I don't think it really delved into some of the issues, the deep, dark mental things that you hide, that you're afraid to talk about. And I think the Institute is promoting more of a program to be more involved with the individuals to help them through their recovery. And I see that as a much better method than the traditional methods that I've been through.
Okay, let's talk for a second about that piece of it. Working with veterans who are, especially the veterans coming back now, although us folks from Vietnam, we've got our own issues too cropping up at this point in our lives, but the folks coming back, in terms of their treatment, have you seen any kinds of improvements with how they're being handled because of the knowledge we've gained around trauma and around PTSD and around trauma-informed care?
The short answer to that is yes, but I don't think that they're getting into it enough as they should. The number of people coming back submitting claims for post-traumatic stress disorder and TBI are significantly larger than in past wars just because of the information being out there. I mean, every veteran that I work with, every veteran advocate that I am aware of, we are always talking to these kids about PTSD, traumatic brain injury, because one of the biggest issues with the military community is the stigma associated with having a mental health problem. In the military, if you go seek counseling for mental health issues, it will dramatically affect your career. And what happens in the military, you get 2 chances at promotion. If you are seeking mental health care through the traditional sources, through the Department of Defense, it is recorded in your personnel file. When your promotion board comes up, the DoD will never admit this, but off record it has been said to many of us over the years that that is part of promotional review. And they may often pass that person over for the first time that they go through that promotion. You come up for that promotion again in a year and a half, 2 years or so. If you're still undergoing mental health issues, that can be another reason for not getting a promotion and a request for resignation, because the military only allows you to get passed over twice. And you could have 14 or 15 years in the military, get passed over for that next promotion, and you are asked to resign and you get no benefits of having a career in the military. So it's very, very important that we develop other avenues like ITEC for getting these people some help. From the Reserve and Guard Center, it fits into the same thing.
Yeah, there's some things that, this may not be part of the interview, but I'm going to ask you this anyways. Because one of the contexts that we always talk about is the issue of military culture. And again, you focused on the promotional issues, but there are other issues when it comes down to this fact as well. When you think about it, from a unit standpoint, from a fire team, okay, you got 4 guys. If one of them decides to go seek mental health, that person is not as well accepted as they normally would have been in that fire team because they're not trusted. If they had that breakdown, the others view that as a negative. Do you see that as something that the military culture can change?
Yeah, your observation is 100% right. You know what it causes, that unit cohesion and everything else. I can tell you from the Marine Corps standpoint that they are now in their NCO schools for corporals and sergeants, providing some counseling work and identifying PTSD and traumatic brain injury. So they're getting some training, very, very surface training, but they are working with the NCOs at the unit level and giving them some basic overview of the symptoms and the things to watch for within their unit. How that will work out, I don't know, because again, the military culture is not to admit that you're having a problem. One of the Marine Corps' recruiting slogan is pain is weakness leaving the body. So that's not just...
It doesn't kill you, it makes you stronger.
Exactly. So, I mean, I think that's still an issue. And quite frankly, you know, the military culture has to be that way because these things that you encounter with PTSD, some of those things like hypervigilance and all of the other things are what keeps you alive in combat. So it's not a bad thing, but it's transitioning that hypervigilance from the combat scenario into walking down the streets in your hometown and hearing a firecracker go off.
Yeah. Again, it's one of the things that you consider, okay, why they're not seeking help, why they won't go for that help. And again, to me, that's a big piece of it, that cohesion, unit cohesion. I know in the Marine Corps they drum that into you. And again, they tear you down and they say, no, it's your unit. You're part of that. If you do anything against what the unit needs, you're not going to be accepted.
You're a liability.
Yeah, that's it. There's no trust. And that's a big thing for those units. So again, from the standpoint of the soldier or the veteran who's got these issues, who's not thinking of being a lifer, but who has problems while they're still in the military, still have a year or two to go, what does that do for them? So again, some of that, like training, recognition, issues of how to reintegrate back into the unit to build that trust, those kinds of things I think are issues that need to be thought of.
Absolutely, because you've got a young 18 or 19-year-old kid that's going to war for the first time and, may just have come from suburbia, where I say, a lot of us in suburbia live in a bubble, and all of a sudden you're thrown into a situation that is totally against everything you know. That alone is a traumatic experience. And then throw in that somebody's shooting at you trying to kill you. So, yes, they need to get that training down and help those people without destroying unit cohesion. And that's a difficult task. Because how do you turn around and say, one of your riflemen in your fire team, you've got PTSD, and I'm telling the chain of command, you've got to get some mental health help. That's tough. But on the same token, I depend upon you for my life, and therefore I don't trust you, and we need to get you out of my unit.
Yeah, there's those issues that really crop up within the military. So again, for me, that's one of the things that when we've had our focus groups with the vets and stuff, that comes across very clearly. And it just was something that was in my head, and I wanted to ask you about that. Okay, so now I'll get back on track. Again, you have quite a bit of knowledge around the issue of post-traumatic stress, around traumatic brain injury with regard to veterans. Have you seen that knowledge that we've gotten over the last 30, 40 years have any influence on society in general?
Yes, I think it has had an effect on it, and I think, first of all, the advocacy on the veteran standpoint and the advocacy in the mental health area. I do some work with the National Alliance for Mental Illness and some other groups, and we're always trying to do is educate people. The Vietnam Veterans of America, once PTSD was recognized, we put out a brochure in the 80s, and we still put it out. The title of the brochure is PTSD Does Not Mean You're Crazy. There was, when those things first came out about the DSM turned around and identified things, there was a thing about crazy Vietnam veterans running around. And, we weren't crazy. We were people that saw things and did things outside the normal realm of living, and we were just looking for someone to talk to, for someone to help us get through what we were mentally experiencing and reliving on a constant basis. We left Vietnam, but Vietnam never left us. And the recurrence of it with things like Agent Orange, where you leave the country, you've been out of the home now for 35 or 40 years, all of a sudden you come down with prostate cancer, you come down with diabetes, all related to Agent Orange. And people are saying, well, why can't you forget Vietnam? Well, because Vietnam's still in my body and still doing detrimental things that are killing me.
Yeah, it's not only you,
Right.
It's your family too.
Exactly.
Your kids suffer because of
Yep.
it as well.
And from that standpoint, I think awareness with regard to mental health issues, at least for the military, is more prevalent, and I think people have a better understanding. I don't hear people say very often anymore, well, he went to war, he's crazy. I hear people say, well, he went to war and he's having some bad experiences. And I think there's been the educational process through formal education in the schools, through veterans advocacy, through mental health groups, I think has helped that. I also think it's helping in the civilian side of things too, because I think, again, with my work with the National Alliance on Mental Illness, the stigma related to individuals who aren't veterans that are having some mental health issues, I think people are realizing it much better now. We don't have the institutions where anybody who showed any mental issues, they just locked them up for their life and put them in the proverbial nut house.
Yeah, I think there's been a lot of work around that, particularly with all the traumas, all the weather-related issues that we're having and the child sex abuse literature that took off in the late 80s, early 90s, and still is continuing to look at it. Those are really important things. I wanted to ask you something else, too, and again, I don't know if it's part of this interview or not, but I want to hear what you've got to say about it. But one of the things that, about the group of veterans coming back, I really, really look at them and I really have a large empathy for what they're going through. One of the things that in Vietnam, when we were there were booby traps, yes, and there were mortars and rockets, but we had our firefights too. The guys coming back from Afghanistan and Iraq didn't necessarily have that. All they saw were IEDs blowing up their vehicles, killing their friends, having no outlet. What do you think the impact is on that? How is that different from our exposure then?
Well, violence is a release for a lot of your issues. And when you see things in war that you find very hard to accept and see what humans do to each other, in Vietnam, I think we had more ability to get some of that out of us and release it. And it's one of the things that I talk to people about with regard to public safety. The younger generation that may not have had that outlet to go through are coming back with a lot of pent-up aggression. And particularly in the areas of domestic violence calls, and that a lot of their aggression is taken out on their loved ones, because the old expression, you always hurt the ones you love. So domestic violence in the military is at an all-time high, along with sexual assaults. The difference with the sexual assaults now is that people are coming forward more than they ever have before. The last statistic that I saw for 2012 was 26,000 sexual assaults in the military last year. And
they consider that underreporting, though.
Exactly. Most of it's not reported. Domestic violence not only involves the family, but now you involve law enforcement on the other side of it. So if there is a veteran getting his anxiety and his depression and frustration out in a domestic environment, now a 911 call goes out. Now you've got police responding. And what you wind up with, and when I talk about the public safety side of it, is if that veteran has weapons, and most veterans do have weapons, you now have an issue where you've got a military person trained not to back down. You got a law enforcement officer trained not to back down. There's going to be some people getting hurt. And so this not just covers the military aspect of it, but it covers the civil aspect of it as well. Because suicide by cop is a well-known thing, that the way to get out of your frustration, you may not want to kill yourself, but you confront police, then they gun you down, and you've got your emotions, you've got all the pain out of you by doing that. But in many cases where they had some Green Berets come back after their third or fourth tour, there was one instance in North Carolina about 5 years ago. 4 Green Berets came back, all of them killed their wives, and then they killed themselves. So the domestic violence aspect of it is a big part.
Yeah, I see that as well, and that's just one of those things that I think we really need to think about hard in terms of how we handle the veterans coming back. And it's like we did some work with some veterans. We just had a focus group with a group of veterans, both the older vets and younger vets, and it was interesting. The older vets all praised the VA for what they were doing for them. The younger vets wanted no part of the VA. How can IDIC potentially have some hope to try and get that so that the younger vets returning here to this area at least have some idea that the VA can be a help for them?
There's always been the stigma about the VA as Big Brother. It's the second biggest department in government, and there's a lot of vets who come back, even though they're all volunteers, they choose to go into the military, that some of them become soured on their military experience. They become fearful of the government and what the government can do or might do to them. And so many of them are looking, when they're ready to, for other avenues to go to. One of the things that we try to do with a lot of the veterans now is at least move them toward the Buffalo Vet Center. The veteran centers were established after Vietnam just because a lot of us Vietnam veterans did not want to go to the VA. We had a very, very long and hard distrust of the VA, so the VA, in wisdom, set up vet centers, which, while they are part of the VA, there's no electronic medical records in the counseling services. It is all confidential paper records. Big Brother does not see what goes in the personnel jacket and what you talk about with your counselor. The other part of it is those counselors are all combat veterans, and that becomes a trust issue. Again, it's very difficult for a warrior to come in and sit down with a recently graduated master's student in social work who's 23, 24 years old and says, well, I'm here to help you. And the veteran looks at that person and says, how the hell are you going to help me? What do you know?
That's one of the things that we heard from them, was the fact that they didn't even know the lingo, didn't know anything about the military. And then that's something that we are certainly using to help with our training of our students. Because, again, understanding military culture is at least a foot in the door.
Oh, exactly. And I taught a course. I served as an adjunct professor at one of the local colleges and teaching a military culture course specifically to social work students and psychology students and that were going to ultimately, if they succeeded, become clinical people. And it was important for them to have an understanding and get the feeling of why it is so difficult. In the civilian world, there seems to be no adverse activities for someone saying, well, I got a problem, I'm going to the doctor and I'm going to get some pills. So civilians look at it and say, well, what's the problem? I had an issue, I went and got some pills. They don't understand that that's not how military people think. Military people think about improvise, adapt, overcome, persevere. You don't admit weakness, you don't admit pain. So it's a completely different culture of people that these clinicians are going to be counseling in the future.
It's something that we are learning as we go through this process for our students, that we're looking at how we can structure courses and coursework for them to get them better prepared. So I know you moved from your position, but you still continue to work with veterans. What excites you about that work?
There's several aspects of it. The first part of it is that I retain a lot of guilt, as many of us do. And my guilt revolves around the Marines that I lost in Vietnam, who will be forever young in my heart and in my mind. And I couldn't help them, so part of my mission is to help those who came back in their honor, because I think I would be doing them an injustice if I didn't do this work to help people who come home with it. The second part of it is the self-satisfaction in working with people, with families, and knowing that in some small way you may have had a part of changing their life. And for the most part, it's all been good. There are some situations that there's things you just can't do, and it kind of eats you up inside. I've got a case of somebody like that right now, and it's just driving me nuts because I can't help them. I've done everything I can and tried to bring in all the resources I can, and I've just not been able to do it. So that's hurtful. But being able to help people, I've been very, very fortunate in my life, and I think it's all part of giving back and helping others who may not have been as successful for whatever reason, because as the old expression goes, if not for one step, there go I. And I suffered my time with alcohol abuse and everything else, and I survived it. And I owe it to those people who put on the uniform and serve this country to do whatever I can to help them.
Okay, thank you for that. Now, the last question kind of talks about IDIC, our role here, and how do you see us potentially having the ability to hopefully have a positive influence on how veterans are served and how they're treated?
Well, I think the first area is the fact that it's coming out of the University of Buffalo School of Social Work. I think this is an important program. Your school does a great job producing social workers, BSWs, MSWs, graduate level, and so on. And I think the educational institution can provide a role such as I was doing when I was at a local institution, of being a place where veterans can come to in a safe environment. They're not being judged when they come in here. They're not being persecuted. It's not Big Brother who, in a sense, is putting them in a room with a light bulb over their head saying, all right, you're going to tell me everything you know or I'm going to waterboard you. So I think the school environment, particularly with the emphasis on the GI Bill, where we're trying to get more and more of the returning veterans into schools to utilize that benefit, it also gives us the ability to give them a place to come and talk and maybe be that conduit that gets them to file a claim so that they can get their disability benefits and so on, and still get some treatment where they feel that there's more understanding, not as much judgment, and more knowledge potentially because of the concentrated effort that IDIC offers versus what I see is traditional, 20-minute sessions that you get in the VA. Some of the clinicians at the VA are carrying caseloads of 120 to 160 patients. You really can't, and again, I'm not a clinician, but I don't see any way possible that someone can give a person 20 minutes every 2 or 3 weeks or every 4 weeks and be providing good mental health counseling.
Yeah, I've heard some good things about Batavia, though, in terms of their PTSD program from the vets that have gone there.
Their residential program is phenomenal.
Yes, that's what I've heard a lot of good things. A lot
absolutely.
Of positive things about
and
that.
now they've got a women's residential program also.
Yes.
So the residential programs are good.
Yeah, it's the outpatient.
It's the outpatient part where that veteran's getting 20 or 30 minutes every 2 or 3 weeks and is crying for help and in most cases getting it. I'm a fan of the VA. I'm pro-VA. But from the mental health part is where I have some issues. I just don't see how people can carry caseloads that large and provide adequate care.
I think we covered all the questions. So you have anything else you'd like to say?
No, I just want to thank you, Tom, first of all, for serving our country as a fellow Marine.
Well, same to you. Thank you.
And I want to thank the UB School of Social Work for putting together a program like this. It's needed, and I'm very honored that I was asked to be a part of it. And hopefully we can take some great strides in helping not just the military people, but all the other people that have some mental health issues.
The families of those vets, too, because that's one thing that we really haven't talked about, and I know you know, and you've kind of talked to us about the issue with the kids in school that are of families that are deployed.
The secondary PTSD in military children is pretty rampant, and what's affecting them is their social life, their educational life, and so on, and because, again, they're in an environment where nobody can understand what they're going through. You may have one kid in a school that's got a parent deployed. His friends have no idea what he's going through or she's going through every single day, wondering if mom or dad are ever coming home. And so it's a big problem. We've tried to develop educational programs to go out and talk to the teachers and the counselors in the schools also to make them aware of it. Don't treat them as a discipline problem. Ask a simple question. Do you have any loved ones serving in the military? And when Janie says, yeah, mom just left for her 3rd deployment to Afghanistan, you don't give her detention. You try to talk to her and give her some guidance and help.
Yeah, I think that part of what you were doing with the schools is a very big thing to do, and that we're trying to follow up with that as well in terms of how we train folks and how we send our students out into the school systems with that knowledge so that hopefully we can have some impact. So I want to thank you, Patrick, for being a member of our advisory board. And again, as you wished me and thanked me for my service, I thank you for yours as well.